when you'll be lonely. Oh.
Ladies and gentlemen, welcome to the program, Women's Series Post-Pandemic Parenting. For this webinar, attendees will be in listen-only mode. If you need technical assistance, please submit your request under the Tech tab in the window in the top right-hand corner of your computer screen. If you wish to submit a question during the presentation, please use the Q&A window in the top right-hand corner of your computer screen. Presenters will do their best to answer your questions. However, due to time constraints, not all questions may be addressed during this webinar. The presentation will now be turned over to Rebecca Mason.
Welcome everyone to our first webinar in our Women's Series. My name is Rebecca and I am your host for today's webinar. I am the program manager for our Live Easy program. And thank you to AccuRisk Solutions and Nationwide, our platinum sponsors. We are so excited to be launching this series in March, which is Women's History Month. 67% of the workforce at HealthEasy is female and is founded and ran by a fierce woman. So we have lots to celebrate this month. We admire all the women joining us today, as well as the men that have had to learn with us as we navigate parenthood and supporting and raising exceptional children in a pandemic. Today, we hope to have an open and honest conversation addressing issues that you all have faced during the pandemic and learning how we can move forward. For those of you who are new to our webinars, we are a third-party administrator located in Bloomington, Minnesota, administrating partially self-funded plans for employers throughout the U.S. We are known for our customization, innovation, and a high level of concierge customer service. I would like to welcome both Dr. Conley and Dr. Kelly today. Dr. Conley not only practices family medicine at Catalyst Clinic, but is also our Chief Medical Officer at HealthEasy. Dr. Kelly is the Medical Director for the Health and Wellness Clinic at St. Catherine's University, specializing in adolescent and pediatric health. They both are preferred providers for America's PPO network, the first PPO founded in the country 39 years ago. In addition to being providers for America's PPO, they have also been clients of HealthEasy's for the last 10 years with iHealth. Thank you again for joining. So we have some questions that we would like to address with the doctors, but again, please submit additional questions in the chat feature and we will answer as many as we can. We hope to address everyone's questions today, but if it is missed, please email easywebinars@healtheasy.com. I will now turn it over to Dr. Conley, who also had a baby in the middle of the pandemic. Can you please share with us about your background and what experiences you have learned either professionally or personally during the pandemic?
Yes, absolutely. So I had a baby in August, about midway through the pandemic. Didn't know it was going to be midway. And then I also have a 2-year-old son who we needed to try to navigate the pandemic. So for me, there was a couple of different things occurring in regards to being pregnant during the pandemic, working as a physician in family medicine, the potential exposure for COVID and what that meant for me, my baby, my family, as well as trying to navigate how to keep a small primary care clinic open while still keeping staff and employees safe. And we're not a group that can really work from home. So it was interesting to say the least, but by and large, it went well. My baby did great. We didn't get COVID. We've done very, very well. We've had to navigate, daycare getting shut down, trying to make sure that we have family in place to get coverage if daycare is closed. But it was an interesting year for my family, but also, we are a small clinic, and so trying to make sure that my staff, when there was a shutdown in the spring, trying to make sure that the staff that I had was able to continue to get the hours that they needed, was able to have the support in terms of if they needed time off to help take care of their children. So I think, we experience a lot of what a lot of you guys are experiencing and have experienced.
Yeah, wonderful. So Dr. Kelly has teenagers, so we're hitting both sides of the parenting spectrum today. Can you please share with us a little bit about your background and what you've experienced or learned, as well as professionally or personally?
Sure. So I have two teenagers, one who is a junior in high school this year, and our oldest son we sent off to college, his freshman year in college. And so last year, when everybody went online, it was the end of Jack's senior year and the end of Kate is our daughter, her sophomore year in high school. And so we had to navigate not only online learning, but also, I would say, a myriad of disappointments about what things weren't going to happen, particularly for Jack, related to school dances and graduation and sports, things like that. And personally, for me, I think my focus shifted as much as possible to supporting my kids. Professionally, my role changed really significantly at St. Kate's, being the medical director. My background is in young adult medicine, and I also have a master's degree in public health, which has come in very useful in the last 11 months. And I really shifted from primarily being a clinician at St. Kate's to leading our COVID response team on campus. And so that meant not only thinking about the health and safety of my own kids, but thinking about the health and safety of lots of people's children, as well as staff and faculty at St. Kate's. So kind of two very different, I would say, experiences in terms of personal and then professional being really quite wide. And we've done well. St. Kate's has done really well. My kids have both done really well. Kate has not had COVID. None of us have had COVID. Jack did get COVID this spring, and I'm happy to talk about that if anybody has questions and his isolation. But I think probably the biggest thing I learned was helping not only my own family and my kids and myself manage ambiguity, but also I would say St. Catherine University, because we didn't, and we still don't have all the answers. And when there's not a lot of answers, oftentimes that increases people's anxiety. So trying to manage that ambiguity at home and also at work were probably two of the biggest challenges for me.
Thank you, doctors. So today we're going to have an open forum covering topics ranging from school, family, work life, clinical and societal implications. So I will start by asking Dr. Conley. Some children have a lot of anxiety about returning to the classroom as they haven't been in school for a year. What can parents do to help with this transition?
Yeah, and I think that I will give a little bit of background, but I think that maybe Dr. Kelly would have a little bit more experience, especially with the age range that she addresses, as I think a lot of this is going to be adolescents. But in terms of the age range that I see, I have a lot of experience with the younger kids, right? 5, 6, 7, kids that are, started kindergarten online, kids that started first grade online, went to new schools, met their classmates for the first time on Zoom calls, and then trying to figure out how do you transition from a virtual relationship to an actual physical relationship with this cohort that you've now met. And so I know that some kids have been struggling with that. So I think the biggest thing you can do, especially for those younger kids, is to have an open dialogue with them. Make sure that you are normalizing that it might feel a little funny to go back to school. You might be really excited to do it, but when you get there, it might be a little anxiety inducing because it's so different, especially for those kids who are either in a new school or starting school for the first time. And it's their first time away from home. It's their first time getting on a bus, going to a physical location, being in a classroom, learning the day-to-day structure. So I think one of the best things you can do is talk to your kids about what to expect and how the day is going to go. You're going to get on the bus, and then once you're on the bus, this is how your day is kind of going to be structured, and these are the things that you might expect, and your friends, are going to be wearing masks, and you need to make sure you're staying in your seat because it's important to, you know, that's how we're, trying to kind of couch it without scaring them. It's a fine line, but trying to make sure that they understand the importance of some of the safety protocols that have been put in place. But I think the biggest thing is letting them know what to expect, and then keeping the routine as consistent as possible. Even if, on Tuesday they say, I really don't like it, I don't want to go to school. Do the best that you can to say, I know, normalize it, talk about what they don't like, and then just try to really stick to that routine.
Great suggestions. Dr. Kelly, so how much is too much screen time now for children since kids have grown accustomed using electronics to navigate through their day at school?
Oh, this is a great question, and I wish I had a definitive answer, but I don't. And I think that it really is different depending on the age of the child. Obviously, I think we've had a lot of things that in the past year that have changed, whether it's parents' tolerance for screen time, whether it was school or for fun. And I think we have also seen that it was, at least for teenagers, what I saw was a way to connect with their friends. So I don't even understand how you see people while you're gaming, but that was a way, at least for my son, to connect with people. And I think a lot of parents recognized that, and I would say kind of lessened up on some of their maybe rules around screen time, which I think was warranted and somewhat of a survival skill, to be quite honest. As we move forward and we are allowed to go back to school and to engage, have our kids engage with their friends in face-to-face venues, sports, that sort of thing, I think it's time to have those conversations with your kids and with your family to decide what seems like a productive amount of screen time for you. And so I think with the younger the child is, the less screen time is appropriate. Teenagers, even up to 2 hours a day for, I would say, entertainment is not unreasonable. But I think the other thing to monitor is, are your kids turning to screen time instead of what now may be available to them in terms of hanging out with their friends? And that would be, I think, as a physician or as a parent, a cause for concern. So if they're choosing a virtual environment over an in-person environment when they have that opportunity, that would be a reason to have a discussion. And I would say some concern about even some isolating behavior or maybe some social anxiety about being with people again. So I would say it's less about how much is okay and more about why are they having screen time or engaging in screen time, and kind of what's productive and what isn't productive.
Mm-hmm. Okay, so kind of springboarding from that, so many children haven't seen, grandparents or other family besides their immediate household. So do you have suggestions for establishing that connection again, Dr. Conley or Kelly?
Yeah, absolutely. I think a lot, like Dr. Kelly was saying, a lot of people have been using Zoom, FaceTime to try to keep a connection with family and friends. And so certainly continuing that as you need to, but in addition to that, setting up dates, setting up activities to do with friends in a safe environment, and letting the kids know, why it's okay now to go ahead and go outside and meet with your friends and go for a bike ride and stuff like that. I think that's one of the important things to try to do to normalize that transition.
A lot of normalizing coming up. Mm-hmm. So, Dr. Kelly, have studies shown that parents are more tired, anxious, or depressed than those without children while handling all the changes COVID has brought about?
I think, yes, studies definitively have shown that people with children are more tired and more anxious. And there's some indication of increased depression as well. And I think the tiredness and the anxiety is completely understandable. A lot of families who were needing now to homeschool their children also had parents who needed to work. And so that created a lot of I think, exhaustion on the part of parents in particular. And I think a lot of the anxiety stems from, one, am I doing this well? I'm not trained to be a fourth grade teacher. And so even if you're not trying to balance work and school, I think there's the anxiety and the pressure that parents have felt about, is my child actually learning something? And I think that is a real anxiety. And I think the other piece is being anxious about sending your child back out into the world, right? So, and just fears around COVID and what that could mean. So we've definitely seen increases in exhaustion and anxiety and depression. And I would say it's pronounced in people who have children and have had to help their children navigate this pandemic.
So Dr. Conley, as a new mom and little ones, so how do you kind of personally and professionally recommend giving your children the attention that they need when all you really need is a moment to yourself?
That's tough. In our house, we have a couple things that we do to try to make sure that people get the space that they need. One of the biggest things that we do is set aside a chunk of time every day in the afternoon, particularly on the weekends, where we have just quiet time. So whether the kids are napping or playing with their toys or reading quietly or doing puzzles, that's quiet time for them and quiet time for us. So we can read, we can get some work done. And so that's been very important. The other thing we try to do is to trade off, right? I will take both children and maybe try to go for a walk and maybe try to get out of the house for a little bit and give my husband 30 to 60 minutes to just do what he needs to do and have his own space. And then he'll trade off maybe on Sunday. Maybe on Sunday I get an hour to myself. And so I think that's one of the biggest things. If you have a partner who can trade off with you, that can be really helpful. And having a scheduled quiet time for the whole house has been really helpful if that's feasible for your family.
Okay. So Dr. Kelly, how is the best way to balance work and home life when working from home? So a lot of us have had now to transition to working from home full time, and we have constant computer and access to work. So how do we kind of balance that?
I think, again, this is a really good question, and I wish I had the golden ticket or an absolute answer. I think the bottom line stems back to Dr. Conley's response to the previous question, which is you really have to schedule your time and you have to create some boundaries for yourself, whether that's with your family or with your work life. Because now I know for myself, people think I'm available 24 hours a day because I could hop on a Zoom call at any minute. Whereas, pre-COVID, there would be a meeting scheduled on campus, for example, for me. So I think, kind of readily being available is not a balanced life. And I think being clear about your boundaries, and you can turn on your do not disturb on your phone. One of the colleagues that I worked with turned off her email notifications on her phone so that when she was working during the day, obviously she's answering her email, she'd close her computer at the end of her workday, and she wouldn't be constantly getting the email notifications on her phone in the evening or on the weekends when she was spending time with her family. And she really found that was the only way for her to truly disconnect from work and just be present for her kids. So I think the most important piece is carving out time, and whether it's for yourself, like Dr. Conley talked about, or it's, I work from 8 to 4. These are my work hours. And when I'm done, I'm done. I'm not going to answer voicemails till tomorrow morning, and I'm not going to respond to emails until tomorrow morning. And I think that's really the best way to do it if it's possible.
Great suggestions. So Dr. Conley, have parents continue to bring in their children for other scheduled vaccines? Has there been any increase in illnesses that had previously been reduced due to the lack of preventive doctor cares that are no longer happening since kids aren't being brought in?
Those are really, again, these are all really good questions.
Great questions.
Absolutely. The CDC has done 2 to 3 studies on childhood vaccinations and has found that there has been a significant decrease, specifically in the measles, mumps, and rubella vaccine. That was the one that they chose to track. But that's usually reflective of childhood vaccinations being on track. And we did see a pretty significant decline in childhood vaccinations, particularly last spring. It has been getting a little bit better as we've kind of started to re-encourage parents to bring their kids in, get vaccinated, get back on track. But there is some legwork to do to try to get everyone back up to speed. So I would say absolutely, we're getting those. I do not think, certainly we haven't seen a recurrence of childhood illnesses that previously were extinguished, right, with vaccinations. We're not seeing polio come back because we do have some very good herd immunity without vaccinations. But it is very important to go ahead with those well child checks, particularly under the age of 2. That's really when these kids are needing to get vaccinated. And then in terms of medical issues, really with kids, I think what may be being missed is the standard strep throat, influenza. These things might be not necessarily getting diagnosed because of the prevalence of COVID, and that if you're going to get a COVID test, you have to wait for that result to go really and do anything. And so we might be missing some influenza and some strep throat in regards to children specifically.
I can add to that a little bit in terms of my experience with, I would say, middle age or middle school age and high school age kids in particular, as well as college age. I think we've seen a significant decrease in is visits related to mental health. So especially early on and even into the summer, as clinics were trying to find ways to see and support patients virtually. And I would say this is for like therapy or therapists, as well as for medical providers who might be prescribing medications. People were really anxious about coming into in-person visits, and we've seen that improve as we have offered more virtual options. And I know a lot of clinics have done that as well, but we're still behind. I think there's still a significant portion of the population that has not had those needs addressed, and hopefully that's going to change. And I think this is particularly difficult for children from lower socioeconomic groups, where there may not have even been an opportunity, for example, to engage in a virtual visit. And so oftentimes students in lower socioeconomic groups will see a provider at a school-based clinic, or there's a nurse at a school-based clinic, and because they're not in school, they don't have access to that care either. And so I think that's a population that definitely has seen a decline just in well child care and general visits, and in my experience, mental health during the pandemic.
Okay. Yes, we had another question come in from one of our audiences, so I think you could maybe piggyback off of this, Dr. Kelly. So the question was, have you been seeing more behavioral issues in children, and do you have any recommendations for addressing it? Our 9-year-old daughter throwing temper tantrums, being disrespectful, and hitting a younger sibling.
Actually, we're seeing a lot more behavior issues, and I have seen this not only in, I would say, my practice, but also friends who have school-age children. I think that being at home has been unusually stressful on children, in particular related to the level of structure that's available at home and predictability. And especially if parents are working, you can imagine the difficulty of having a seamless structured schedule like they might, for example, in a third grade classroom. And then when you couple that with just children's, I think, general anxiety that's difficult for them to articulate related to COVID and the pandemic, what we see is often some lashing out or behavioral issues. I think one of the most important things is, obviously, if you identify that something is different about your child, that you're noticing behavioral changes, I would talk to your pediatrician. I mean, I think or your family medicine doctor. That's the first place I would go. Occupational therapy, a lot of times we don't think about that necessarily with kids, but occupational therapists can do a wonderful job helping children to learn some, I would say, anxiety management and just emotional management skills that they may not have had the opportunity to perfect before the pandemic started. And so we're seeing some of that acting out. And so I have definitely seen some benefit from occupational therapy in kids who are struggling with behavioral issues, whether it's home or as they transition back to school. So that would be my primary recommendation, is identify it and then seek out some help from your primary care provider and or occupational therapy.
One of the things that I do see a lot of, particularly in that age group, is there's a lack of decision making, right?
Mhm.
For that 9-year-old, she or he feels likely like they have no choices. They don't get to make any decisions, and they are really in a stage of their development where making choices is very important to them, and they're trying to develop that independence. And so for the last year, a lot of that independence has been taken away from them. They're being told, no, you can't go to school, you can't see your friends, you can't, we can't go shopping, we can't do this and this. They're being told no time and time again.
Mhm.
And so I think one of the things that can be helpful is trying to offer choices that are acceptable options and letting them make decisions to the extent that you can. As for little kids, for my son, for example, letting him choose his clothes, right? He's 2. That's a decision he can make. For a 9-year-old, it might be choosing an activity that they want to be involved in. It might be choosing what to eat for dinner that night, something as simple as that, but giving some choices in a structured environment that that either option is acceptable to you might be helpful as well, in terms of trying to give them some power back.
Yeah, I think that's a great idea and a great response.
Yeah, thank you. So one of our other questions that came through from the audience member is, when do you think the normalcy will return to hospitals on having visitors come, post-surgery, baby delivery, etc.?
Who do you want to answer the question? You want me to answer?
Yeah, do you want to answer that?
Sure. I think it's going to be relatively soon. I think what we're going to need to see is extensive and ubiquitous availability of vaccination. And what I anticipate is that we will start to see an expanded access to hospitals and that sort of thing in people who've been vaccinated and who can document that they've been vaccinated. Thinking about the CDC's most recent change in their guidelines related to unvaccinated people, or vaccinated people, being able to socialize with people who've been vaccinated and people who've been unvaccinated if they're at low risk. And so I think that's the first thing we're going to see. I think that it's imperative that our hospitals and our nursing homes in particular continue to protect people who are vulnerable and are at high risk of COVID. And I think that vaccination will help with being able to expand access to those areas. I know that that's been a particularly difficult and painful experience for people who either have people who are sick and in the hospital, who are having babies, or parents or grandparents who are in nursing homes. So I think we're going to see that start to expand.
Cool. Exciting times. So kind of getting back to clinical. So what are some of the signs of depression to watch out for due to the isolation, and when should you start seeking attention? Dr. Conley?
I think a couple have already been addressed, and Dr. Kelly mentioned this earlier. Isolation and choosing like she said, the virtual world over the real world when given the option is something to keep an eye out for. Things that I generally see that might be a little unusual and you might not think of depression would be increased fatigue, not really having any motivation or energy to get up or go to school. Someone who previously enjoyed an activity that now they're kind of like, I don't really feel like doing it. But one of the biggest things that I see, particularly in the ages of 10 to 18, and Dr. Kelly can speak on this as well, would be fatigue and lack of motivation. Just I don't feel like it.
Yeah, I think what I would add to that is oftentimes, particularly depression in young adults, can manifest as irritability. So just kind of more anger or more, I want to say like intolerance of family members, that sort of thing. In addition to the being more withdrawn, lack of motivation, and just lack of desire to, I would say, interact with the real world. Those can be real signs of depression and or anxiety.
Okay. So another question. We have kept our almost 1-year-old daughter fairly isolated from extended family and friends. How can we help to ensure she's getting the socialization that she needs?
So actually, I saw this question before, and it's interesting. In the United States, we really push for socialization, right? A lot of kids start daycare between the ages of 6 weeks and 12 weeks. There's all sorts of courses for ECFE and early childhood development, which is fantastic. But if you look at other countries, a lot of parents have maternity leave or paternity leave for 12 months. So a lot of parents are home with their kids. Their kids are not starting daycare or these programs for at least a year. And so if you talk to people who live in other countries in Europe, in Western Asia, they will kind of say, you know, socialization is really not as important as the US pushes up until a year. I think at a year is a time when it starts to become important, where you learn to socialize. But that first year, it's really all about developing gross motor skills, identifying mom and dad, learning how to eat, learning how to sit, some of those skills. Socialization, really, I don't think you need to start worrying until a year.
Okay. So then, Dr. Kelly, so what do you do if you feel like your child or your children are isolating and no longer engaging with others?
Well, I think depending on the age of the child, you want to open up a conversation with them about the fact that you're noticing some changes in their behavior, and you're concerned, and you would like to know if there's anything bothering them, or if there's things that they're worried about, or particularly sad about, or particularly scared about. So I think the first piece is really addressing the behavior that you're seeing. And then I think it's finding ways to help your child engage depending on what that might be. So if it is a fear of COVID, it is finding ways for your kids to interact with, whether it's friends or family members, in a safe way. Again, with some of the expansion now with households being able to get together a limited number, there is the opportunity for kids potentially to see friends. Now that it's nicer outside in Minnesota, we talked about going for a bike ride or going for a walk. So helping your child identify ways that they might want to interact with other people. I also think it's important, particularly if it's related to anxiety around COVID, to address their fears. And again, depending on what their age is, it's going to determine how much information you give them. But part of it is you, I think, modeling behavior that that the kids can then follow. So whether that's engaging with people, wearing a mask, social distancing, but saying, you know, this is how we can be safe and still engage with other people, I think can be really helpful in allaying young children and young, I would say, adolescents' fears around if they're going to get COVID if they're with other people. The other thing that I've seen quite a bit in both of my older kids is a real desire to be with other people, and almost feeling guilty about wanting to hang out with friends or be with friends, particularly my son who's a freshman in college. And so, you know, one of the conversations we've had to have is related to, I would say, negative feelings around COVID is guilt around being with other people, even if it's in a safe manner. And so I think, you know, having the conversation about why they're not engaging or withdrawing is the first step. And then finding ways to address those concerns or issues and helping them and supporting them, and then role modeling for them what healthy interacting with others at this point looks like. So there is going to be a transition period, and I'm sure we all know people on both ends of the spectrum in terms of comfort with COVID risk, and our kids are no different. And so I think assessing where your kids are with that is really important as we encourage them to a back to normal or near normal interaction with others.
Yeah, thank you. So kind of springing from that, Dr. Conley, what do you see being the long-lasting psychological effects of the pandemic across the society, whether it's children or adults?
Again, I think it's a lot of it has to do with the age of the kid. My kids are 2 and 7 months old, so for them, probably, they won't really have any memory of this, which I'm very, very grateful for. For the middle school, elementary school kids, there will be some memory, but it won't, for the most part, impact their development moving forward. They won't have much memory of this year, or this 2 years. I don't know. I don't know when things are going to normalize, but until things do, I think the people who are going to have the biggest impact, and this is where we're really going to have to dig in, would be Dr. Kelly's age group, that adolescent group who is missing out on some really big milestone events, graduations, starting college, the prom, homecoming, all of those things that group, particularly juniors and seniors over the last couple of years, have had to miss. Trying to help them process that is going to be really important. And another thing, unrelated to COVID, I think that there has been a huge divide in our country right now in terms of response to COVID and how people feel about the entire process, about masking, about social distancing, about shutdowns, lockdowns, what have you. I think one of the biggest things we as a society are going to have to overcome moving forward is bridging that gap and trying to become friends with everyone again, regardless of how you feel. Just getting back on a level where we can be acceptable and tolerant to everyone. And I think that's really going to be, beyond the medical impact of this, the sociologic impact, I think, is really going to depend on how we respond over the next 12 months to people that maybe didn't agree with us over the last 12 months, and just trying to get on board and understand where everyone's coming from, and that, some people are worried because they lost their restaurant, and some people are worried because they're at high risk and are terrified of COVID. And we need to try to get that conversation going to say, hey, I get where you're coming from and I understand, and let's move forward.
Thank you. So I guess kind of on the flip side, are there any things that we learned that we want to hold on to permanently? I guess either of you.
I mean, I think one of the things that has really been a silver lining, I would say, for me, is seeing how resilient people are, and seeing how even my own kids or the young adults I work with at St. Kate's, how resilient people are, and how, what do I want to say, inventive we are. I mean, I think of all the things that happened in March last year, and we were all like, how are we ever going to do this? And people are amazing. Human beings are amazing. We figured out ways to interact, to be together, to have Zoom meetings, to do grocery drop off and pick up. There were so many things that have changed that I admire the resilience of human beings. And so I think that has been definitely a silver lining for, I think, the pandemic is just recognizing that people can be amazing when they put their mind to, solving the problem. And the other thing I would say is people helping other people. Just the number of stories that I've had personally or even professionally of people supporting, if it was elderly people who needed groceries or things like that. So I think just kind of that caring spirit that I think helps to offset what Dr. Conley was talking about too, with the real divide, is that, and I think that definitely needs to be addressed and will be an ongoing issue. But I think at the same time, I save myself from being totally, I guess, depressed about that aspect of it by also looking to the number of things I've seen where people are helping other people. And that's even, companies who donate millions of dollars to, for example, small businesses or restaurants to help keep them afloat. So I think I would say resilience is one of the things that has really stood out to me.
I'd like to
Yeah.
kind of piggyback on something that Dr. Kelly mentioned earlier, in that I think we identified some deficiencies in our society in terms of where are there gaps of care. We identified that, like you said, people of lower socioeconomic status are having a harder time, and with telehealth and some of these outreach programs, we can actually provide better care. We can provide good care via telemedicine, which was really not an option before. So I think we can reach more people with with better access with what we've, like you said, with what we've come up with in the last year.
Mm-hmm.
Okay. Well, thank you. This has been such an insightful conversation, and yeah, have definitely learned a lot from both of you, and yeah, where we've gone and potentially where we will be going. I'd like to open it up in case there is any other last minute questions for people to be asking. Let's see here. So another question, your optimism is palpable. How are you so optimistic given everything that has transpired?
I think it goes back to I have faith in humankind. I do. I think we are gonna find our way through this and out of it. And I think hopefully we're gonna take the good things and learn from them, and the things that haven't been so good and apply them going forward. I also think we are a generation who has not had to deal with anything like this. So you think about our grandparents who had to deal with the Depression and wars and polio and those sorts of things. And I think it has afforded us a perspective. My hope is that for not only care about ourselves, but care, what I do personally, whether I wear a mask or follow the guidelines or whatever, affects other people. And I think there has been some learning of that. And so I also feel very optimistic about vaccine, and maybe it's the weather and things getting warmer, but I do think we are headed in the right direction. Minnesota yesterday had no COVID deaths. That's the first time we've had no COVID deaths in Minnesota since April of last year. So I think there are signs, both from a pandemic standpoint and I think just from a social standpoint, that I think things are getting better, and I'm going to stick with that.
And then let's hear, we got one last question. So any suggested shortcuts for those who have children in crisis? Dr. Kelly?
I think it is reaching out to people who can support and or help you. And I would look again first to professionals who can be of service. So I think particularly if it's a mental health crisis, reaching out to mental health care providers or your primary care provider and getting support. And I think especially right now, but I always talk to parents about this, that when your children are in crisis, you're in crisis too. And so making sure that not only do your children have the support and the resources that they need, but that you also have the support and the resources that you need to help your child through whatever is going on. And so I think that I don't know that there's a shortcut other than identifying resources and kind of circling the wagons, getting all the support that you can to help your child navigate whatever crisis they're going through.
Thank you. Thank you so much, ladies. This has been an amazing conversation, and thank you for everyone for attending today for our first Women Series. And then we'd also like to thank again our Platinum sponsors for our Health Easy 2021 webinar series, AccuRisk Solutions and Nationwide. Thank you.